Welcome back to Stages of Readiness for Change, Unit 1, Group 10. You're still in the QuickStart Guide for Recovery from Addiction and Co-occurring Disorders by Dr. Dawn-Elise Snipes. We have talked about pre-contemplation. We have talked about contemplation, thinking about, whether it's really enough of a problem to do something about. We have talked about preparation. You've realized it's a problem and you're getting all your ducks in a row so you can start taking action. Now, lo and behold, we're talking about action. You are leaving on your trip. You are ready to go. You are ready to start the recovery process. It's going to be important during this time to maintain your motivation. So you're going to want to go back over those first activities that you did in the motivation series and refresh your memory on all of the reasons that you want to make this change. How is it going to make you feel better physically? How is it going to help you feel better affectively or emotionally? Does it make sense that recovery will help you be the person you want to be? How is it going to improve your environment and your relationships when you're in recovery? A lot of times when people are in their addiction, their environment is very stressful. And when they're in recovery, there's a lot less stress in that environment. So that's one major benefit in the environment for recovery. So think about all of the ways that recovery is going to make your life better, to enhance your motivation. And you need to review these things on the daily. This is a summary activity. You're going to take everything that you've been learning up until now, and you're going to put it all into this preliminary relapse prevention plan. And I say preliminary because as you go through treatment, you're going to address it, and you're going to change things, you're going to add things. That's okay. But we need to start somewhere. So physically, how is recovery going to improve your health, your energy, and your pain? Physically, what can you do to ensure you have enough energy to focus on recovery every single day? And physically, what are prior physical relapse warning signs that you had, and how can you cope with them? What are physical things like pain that may have triggered a relapse in the past, and how can you cope with it? Affectively, how is recovery going to make you happier? What are you excited about in the recovery process? What can you do each day to increase your happiness? Just flat out, what can you do to make yourself happier? Is it Pinterest? Is it Instagram? Is it cat videos on YouTube? Playing with your dog? What is it that's going to make you happier? Make sure you're doing something every single day to increase your happy chemicals. And what are prior emotional relapses, and how can you cope? So what things in the past, anger, anxiety, resentment, jealousy, guilt, what emotions have triggered a relapse in the past, and how can you cope? The next dimension is your cognitions, your thoughts. How is recovery going to improve your attitude so you don't have a negative attitude, so you're not involved with stinking thinking? How can recovery help you make better decisions and improve your focus and concentration? What thoughts can you add each and every day that can help you stay motivated and maintain your courage? And what are your prior cognitive relapse warning signs? That is, in the past, how has your thinking changed that has indicated that you were headed down the path to a relapse? And what can you do to address that? Environmentally, what can you add to your environment to keep you motivated? Thinking about, smells, sights, and sounds. There you go. What can you add to your environment that's going to help keep you motivated? You can maybe have a big book in your desk. You can have a bracelet that reminds you one day at a time. You can keep your 30-day chip with you. What can you do in your environment to help you stay motivated? What do you need to eliminate from your environment to prevent yourself from being triggered? If you are trying to quit smoking, for example, you may want to clean So there are no cigarettes in the house, there are no matches, there are no lighters, and there is no smell of nicotine. What are prior environmental relapse warning signs, and how can you cope with them? So in the past, when you've relapsed or when you've started down the road to relapse, what has changed? Have you started hanging out in unsafe places? Have you let unsafe people be around you, people who are still using? Have you withdrawn into your house, into the darkness, and become more self-isolating? What are your relapse warning signs? And finally, environmentally, how will recovery improve your relationships, at least the relationships that are important to you? Which people, and I encourage you to try to identify 3 to 5 people that will encourage you on your recovery journey. Some of these people you may have known all your life. Some of these people you may have just met in support group meetings, and that's okay too. But knowing 3 to 5 people that can be there to encourage you on those days that you're having cravings, on those days that you're feeling frustrated, is going to be really important. And what are prior relapse warning signs in your relationships or relapse triggers in your relationships? And how can you cope with them to prevent relapse in the future? We've been talking, throughout this unit about physical, affective, cognitive, environmental, and relationship aspects of motivation, as well as all of those aspects of you, because all of those things need to be happy and healthy in a full recovery sort of scenario. Final thoughts. You need to get to know and trust yourself. As I said earlier, I can give you suggestions, but what works for you may not be exactly what I suggest. So get to know and trust yourself. What's going to work for you? What do you feel motivated to do? What do you know is a relapse trap for you? Find 3 people who can provide constructive feedback, remembering that, you are the expert on you. But it's important sometimes to have people in your life that can provide their observations. Take what's useful and leave the rest. Don't get all wired up about it. Just hear what they have to say. Figure out, why is it that they're seeing that, or why are they saying that? How might they be coming to that conclusion? If it's accurate, if it's useful, take it. If it's not, leave it. We're not going to be, any person other than yourself is not going to understand exactly what's going on in your head. We can only tell you what we see and what we might be speculating is going on. Remember to regularly explore the pros and cons of your situation and try to address, eliminate, minimize any of the problems that are there. So if you notice there are certain tensions coming up in a relationship, it's going to be important to identify those, not just turn a blind eye to them, but as they start to come up, as there start to be, little other brush fires in your life while you're in the recovery process, it's important to regularly acknowledge those and deal with them. Remember to compare your perception of problems to other people's perception of the problem. A lot of times especially in addiction, but sometimes even with depression and anxiety, we've spent so much time rationalizing, minimizing, and denying it that we think what we're doing is perfectly normal or perfectly okay or not a problem. So we do want to hear other people's perceptions and again, ask ourselves, how might they be coming to that conclusion? And if we have a realization that, maybe they're right, then okay, that's useful. Take it. If not, then leave it. Remember that change is a gradual process. You did not get to this place overnight. Recovery will not happen overnight. The addiction helped you survive until now. And it's going to take a little bit of time to develop alternate tools to deal with the stress and distress of life. Finally, remember in this process to focus on your strengths, not so much your weaknesses. What is it that you can do? What is it that you do have control over? What is the next right step you could make instead of the 3 wrong steps? Focus on your strengths and looking forward towards your goals.